Yeah, bottle.
Wobetimi Azito Radio live and tune in modern Ghana www.azitoradio.co.uk. Azito Radio, we keep you alive.
Yeah, good evening, everyone. We are live on Pasito Radio. Help tips with Akua Boateng. Akua, welcome to the studio.
Thank you. I hope you're okay.
Grace of God is still keeping me.
Okay. Hi,
everyone.
everyone.
Today is another day. We are waiting for what you have on table for us because we're always learning from you.
Yes, I will talk about diabetes. I'll talk about both the type 1 and then the type 2 diabetes, and then I'm going to talk about people may we have basically we have the type there are 3 types. The gestational or whatever we call it, someone who is pregnant,
gestational
or whatever, and then type 1 and then the type 2, and how you will feel, and someone may not even know if they have it, and then the signs and how to deal with it if you are living with it. And someone may think, oh, I don't have it, and then when it may not happen to me because of my age, or I am young, so it can't happen to me, or I am old, so it can't happen to me. The age range and everything, that is what we are going to discuss here today. So if someone knows anything about it, the person can chip in. But if you also have it as well, please, you contact your doctor or your GP. That is not what I am here to do. I'm not here to tell you the medication to take or what you have to do, but I am going to enlighten you of what the signs to expect, and then how to cope, and then how to live with it, and what the type of things you will see around you that you may not know you have it or you do. That is what I am here to talk about. Yes. And then what sometimes someone will be worried about it. If you are worried about it, what you have to do, who to ask, and then those sort of things. Some people say I should speak in Tree. Sometimes I'll go back to speaking my local language. So let me know when to talk or speak in Tree, and I will do that gladly. Thank you.
Some people want you to do it both languages.
Yes, I've got so many messages about that.
It's all right, because when I do with the dietitians and the nutrition, we mixed it, so I think it's all right. It's no problem.
Okay. So the question is, are you worried that you or your child or someone you know may have diabetes? Yeah. Have someone had or shown any symptoms? So the common symptoms to look out for are, someone may be getting up so many times in the night to go to the toilet. If I'm talking about toilet, I'm not talking about going to do, excuse me to say, number 2. Number 1 is going to do the pee or wee, to urinate. And then number 2 is going to do the poo or toilet, as the one we call toilet. So if you keep going to the number 1, wee, several times to empty your bladder, if you see that one, especially at night, if you keep going several times, there might be a symptom of you having diabetes. And then someone be thirsty. You may be thirsty. You keep drinking water all the time. If you keep drinking water, you may be drinking water, and then all of a sudden you get up again. You are thirsty again, and you have to go for more water. If it keeps happening, several times, you might be, it may be a symptom of you having diabetes. Another one is when you feel tired. You may not have done anything or any manual work or any tiring thing that you have to be tired all the time. If you keep getting that tiredness all the time, it might be a sign or a symptom of diabetes. You have to check for that as well. And then if you haven't done anything, if you are not trying at all to lose weight, and then you keep shrinking, if you don't have, pardon me, if you don't have HIV, if you don't have any serious or deadly disease, and then all of a sudden you are eating well, you are doing everything normal, and then you find yourself losing weight all of a sudden when you are not eating just salads or anything that will make you lose weight, and you find yourself losing weight drastically, you need to go and check. Find out why you are losing that weight all of a sudden. It might be a symptom. And then genital itching. Genital itching. It can be from the both men and women. Don't think you've got a thrush or you are growing hair from the private part, or you've used any chemical thing, or you've changed your washing liquid or liquid powder or whatever you use for washing. If you haven't changed from bio to non-bio, and all of a sudden you get itchiness down there, and it's giving you headache or problems, it might be a symptom of diabetes. Another thing is cuts and wounds. I remember when I was a child, we used to call something like jato crow. Those things, when someone gets hurt or there's a wound, that will never heal. That never heals. A crow that never heals. That might be a symptom of diabetes. And then blurred eyes. Your eyes, if you don't wear glasses, or even if you wear glasses and you see things blurry, like there's a windscreen is blurred with water, or it's raining, and then, or if you don't see any of those signs, but you are even indoors and you see blurry things, those are all signs of diabetes. And I was having a chat with Mama Bana this evening, and she said, oh, sometimes you can find that you keep getting hungry, and then you end up like keep checking, pricking yourself to see if you've got it. Yeah. If you keep getting hungry for no reason at all.
Because there are some of the tablets that when you are on, it makes you eat so much. So yes, don't give a chance and say, I know I'm getting hungry because of this. Because you know that maybe the medication is making you getting hungry. You need to help yourself as well. Because yes, if you keep listening to yourself, how the angry is, and you can't control, at the end, by the time you realize you're putting on so much weight, and this weight is what leads to all those things. So at times we need to be careful how we go about things. It depends what tablet you are on. If you see things changing, this fatness is there. If you don't take care, you just be going. Because some people, they can eat and eat, they won't get fat. But some of us, yes, the little that you take, you see yourself bloating and bloating and bloating. So we need to be careful of
it's true.
What we do.
I would say even if I smell food, I just put on weight. Yes, but I know a friend, I call him my brother, he's on Facebook. He'll eat everything and he will still look the same way. He never puts on any weight.
Some people are just like that.
Some people are just like that. Yeah. So These are some of the things we need to look out for. And we don't have any age range. It can happen to a child. Yeah. It can happen to an older person, especially from the age of 45. When you're talking about the older people from 45 going, it can happen to anyone. And then the children as well. It can happen to everyone. So, but the most common ones to look out for, talking about the symptoms, are someone will say the urination. The urinating part is deadly. When you keep urinating, and then the thirst one, when you keep getting thirsty, those are the most common ones. And getting tired as well. Every time you feel tired, these are the most common ones you have to look out for. And I don't think it's expensive, and then it's not like you have to go and test for this at any secluded space, or you go to space to test for them. You go to your doctor, or even any pharmacy can do it for you. There's no special place that you have to go for to test. So you can go easily and then test for them. Go test for it and be safe. You even get a peace of mind. You don't get scared that, oh, what is happening to me? What is going on? Just go and test for it and be at peace within yourself. And then if you do that and you are free, you know you are free. If you have to be on medications, your doctor will handle it for you. For that, I don't have anything to do about that. It's up to you, between you and then your doctor. And sometimes if it has to do with your lifestyle, exercising is good for us. Don't be a couch potato. There are some of the basic things you can do for yourself. How you get it, some from birth, life history, it runs in the family. If a family member has it, and it can be hereditary, it can be there. That is how it comes about. Some you get it, some by chance or from the family, as I've said. But the main thing is how to take good care of yourself, how to eat healthy lifestyle. If you find out you have it, how to eat, and then the things we ingest into our systems. Like, for instance, it's not just us, everyone, we need carbohydrates. We can't do away with carbohydrates. We have to eat it. Most of the time, we depend solely on rice. Most of the time, rice is part of our life. But it's how much the intake. This is where I come in as me saying I've done a bit of nutrition. So that is where I come in. How much you eat. How much you eat. A little bit of the rice, and then you add a little your salads or your vegetables. That will help to curb the bit of the carbohydrates. Cut down the carbohydrates and add more of the vegetables. And then, because I'll be honest with you, we can't do away with carbohydrates. We still need it. So we will still eat it. And then, why carbohydrates? Because of the sugars in it. The sugars in the carbohydrates builds up. And it all brings us all these problems. We eat sweets, and then if you've done all these, you find out that exercising, walking about 30 or 15 to 30 minutes a day might help. It's not about just food alone, but exercising also helps. That's why I'm saying lifestyle, the way we live, our life also counts. So it's not just about the drinks, the food alone, but exercising a little bit. Walking, if you can walk, not just running, but walking a little bit or doing something by yourselves, even if not outside on your steps. it will do you good as well. If you find out you have this after you've done the test and you have the symptoms, all this can help.
And even if you don't have it, for your own self, exercise is very good.
Yes.
You don't wait till you have it first. So even if you don't have it, by doing constant exercising every day.
Yeah.
Because some people, it's just from a car, home, work in the car. So you don't have much. And maybe the sort of work you do, you don't walk that much. Yeah. So exercising will be really, it's good for the body every day.
Mm-hmm.
It's just good for the body every day. And now that the weather is really good. So even just walking on your street.
Yeah.
Because some people, they don't do much when they're at work. It's not physical. So they don't do much of the walking and all those things. So if you are that type that you're working from home, or when you go, you are beside a computer, or what you do, you don't really walk, try your best to at least exercise a little bit. It really helps.
Okay.
Akua, you were saying that some people wanted you to go into that language. So what do we do now?
Yeah, we can change and then talk about
the same thing here.
Yeah. Okay. Now me say diabetes. Diabetes I mean when it trika.
Normally, I'm kind of say yare.
Okay. So who say obi wa yare a and I say well feel say honam mu no enema enkoso yie ma say wo ho na say ekom de o ana esukom de o ententem and anaasɛ wokɔda n'adwo na sɛ wosɔre kɔdwo nso hyew a na ɛkyerɛ sɛ biribi ɛnkɔ yie ɛwɔ wo ho enti no ɛwɔ sɛ wohu sɛ wopɛ ano aduro ɛno no ɛnyɛ waa wopɛ ɛna ɛwɔ sɛ wofa ɛwɔ sɛ wokɔhu doctor ayaresafoɔ na wohu deɛ nti a deɛ ɛma wokɔdwo nso ntɛntɛm no anaasɛ sisukɔm nso de wa wonom nso bebree wanom nso sɛsia ne sukɔm san de wa ɛwɔ sɛ no nso wopɛ ano aduro ɛwɔ sɛ wohu deɛ ɛhaw enti ɛwɔ sɛ time bia wonom nso saa ana afei nso ɛwɔ hɔnom a wo hɔnom no wonyɛ wadwen sɛ wopɛ sɛ wo so te ana wonfa aduro bia nso a ɛwɔ sɛ wo so te ɛnso da bia wo so tea na ɛte wo nso a wonya HIV ɛnso da bia wo so tea na ɛte ɛno nso ɛwɔ sɛ wohu sɛ biribi nti na ɛkɔ saa nti na ɛwɔ sɛ nso wopɛ ano na wo so ana wo a wonya ode pua baba so saa yare na ma wase keka wo no woyɛ ɔbɛrima nso a ebia na wo bɛrima mu biribi saa na sɛ ho mpo no nwi na ɛwɔ hɔ na ɛborɔ de saa nneɛma na bɛgu hɔ no mu na ɛrew wo a wo sam na wogye si nneɛma no wo nsesaayɛ ana akɔfa saa problem ni nyinaa aba ɛnso no wo hɔ kekaw nneɛma mu asesa ɛwɔ aseɛ hɔ no mu no ne nyinaa etumi saa diabetes no etumi ɛma saa problem ne ba wo deɛ sɛ ɛnyɛ no kora mpo a kɔ na kɔhwɛ sɛ ebia na ɛnyɛ no diabetes no sɛ wo mu ahodoɔ mmiɛnsa yɛwɔ no baako type 1 type 2 ana apemfoɔ enso deɛ no mo nyema etumi ba saa mmiɛnsa nyinaa no nso no yɛwɔ mu sɛ ne nyinaa ɛbɔtoa nso a ebu hɔ no ma ɛyɛ efie busua mu ana ebu hɔ nso a efie busua mu kora a wotumi nya nti saa nneɛma wee nyinaa no sɛ nneɛma a mebɛbɔ ɔbɔ so ebu hɔ nso a ne tete ne yɛka bi sɛ gyatɔ yareɛ obo ha ekuro tu no a enwu da saa diabetes etumi ma saa de no eba ana obo hɔ nso ɔte hɔ no ma da bia na ɛkɔm de no da bia na ɛkɔm de no saa diabetes etumi ma saa de no eba ɛro na etumi nso ɛkɔfa saa de no eba no ana bi wɔ hɔ nso a wo hɔ no ma da bia wo de na wabrɛ wonya adwuma bia kra wote hɔ kra na wabrɛ da bia na wabrɛ ne nyinaa nso ewe etumi kɔba ana de ma ebiem na me mbɔ so ana wani da bia sɛ biribi ɛtare wani so tan uhu nneɛma bisa ne nyinaa diabetes etumi ɛma saa de no nyinaa ɛba nti sɛ wohu saa nneɛma wei nyinaa wɔ sɛ wokɔhu doctor na wo ne ne ka ɔmo wɔ test a ɔmo yɛ ɛnyɛ eyi bi a ɛɛden yɛde adeɛ wɔ wo nsa no ne atwe mu gya kakra ne ahwɛ sɛ saa yare no bi wɔ mu a ɛwɔ mu a ɔmo nim deɛ ɔmbɛyɛ but ne nyinaa mu no so yɛ nyanyaa nneɛma a yɛdidi bankye ɛmo ɛne anima ne nyinaa ɛsikyire wɔ mu nti ne yɛkasa ɛsikyire yareɛ no ɛyɛ bebree na ɛtae mu a ɛtumi ba saa ebi wɔ hɔ so abusua mu obi wɔ abusua mu na ɛwɔ mu a yɛde wo a na akɔyɛ te sɛ abusua nto ɛtoasoɔ no na ama saa adeɛ wɔ ɛsɛ nyinaa akɔba then so sɛ wotumi yɛ exercises bebree a ebi wɔ hɔ no a ɛm sɛ number 2 deɛ no etumi gyae
ɛwɔ wa no abɛhwɛ wo ho so no
wobɛhwɛ wo ho so yie no etumi gyae nti no ɛwɔ ɔkwan a wɔabɛfa so a ɔbɛyɛ ɛna baabi a wokɔhwɛ no nso no ɛnyɛ bi a ɛhu fitiri bi a wontumi nkɔhwɛ wo waawo yare ne ade no waawo doctor hɔ motumi hwɛ baabi yɛ gin pharmacy shop ne baabi ɛka ne chemist ne adade no ɛhɔ no
ne boa kora nyɛ den wɔ chemist
ne boa nyɛ den nti hɔ no baabi hɔ kora yɛ ntɔn nti na hɔ no mo na no waawo tumi kɔ ɛkɔtɔ na waahwɛ na wayɛ w'adeɛ nti enya de a ɛyɛ hu bebree saa ɛmo ne ade nde yɛntumi ngyae di banche ne ade ne yɛhia carbohydrates no ɛwɔ yɛ ho yɛ mu nti no still yɛbɛdi but sɛ ne yɛbɛtwa so kakra ɛne sɛ ne yɛbɛhwɛ yɛn honom so yie no ɛno ɛna ɛbɛma yɛbɛhu sɛ nea yɛbɛhu how a yɛbɛtumi ahwɛ yɛn ho so ana ne mmienu no nso no sɛdeɛ ɛbɛyɛ a yɛbɛhu sɛ yɛwɔ saa adeɛ no enti ɛhe ana sɛn ɛne yɛbɛhwɛ yɛn ho so yie no ɛno ɛne yɛbɛbɔ so no yeah
so there's
yɛsan ka nso sɛ deɛ bɛma wahu paa sɛ wowɔ saa yareɛ no yɛ dwonsɔ no bebree no ɛne nsuo nom bebree ɛne sɛ ɛna ɛfɔn no ɛna sɛ ya na wabrɛ ɛno paa na mahu sɛ wanya saa yareɛ no tɛ no ana na meka ne brɔfo mu no
ti wɔ hɔ na ho saa difference na ɛntwentwɛn so anaasɛ wowɔ abusua mu na anim sɛ saa deɛ wɔ bi wɔ abusua mu a wɔ sɛ wankasa wo check wo life
wɔ sɛ wo start check wɔ sɛ wo start check ɔne wo ma nyina wɔ sɛ wo start
wo maame nya bi wɔ sɛ wo hu sɛ ɛwɔ mogya mu ti wo no wo so bɛsonso wo ho a ɛmma wo nso wo konya saa nsunsuasoɔ no bi
yeah. And then we talk about diabetes and the risk factors. The risk factors are the risk factors. No, these types are the ethnicity. That's what we were saying. That it might be
www.azitoradio.co.uk. Azito Radio, we keep you alive.
Okay, ethnicity. We talked about us, like ethnicity, it can be found mostly in the blacks and other races, not most of the whites. And I was talking about us, like we eat a lot of rice and cassava because of the fufu. That's what we have mainly in Africa. Gari and all those things. So definitely, we all need to check. And then if you ignore it, especially the type 1, if you ignore it, and then if you don't treat it, there are so many health problems that can occur in adults, especially in the children as well. And it can be fatal. So it's something that we really, really need to check most of the times. If you delay it, it can affect many organs. Diabetes can affect many organs. So we have to really check it before it's too late. We don't have to leave it unchecked. And I've told you where you need to go to check it. So if there is any question, certain things, you don't have to eat it. I'm not here to tell you what not to do. I've told you what to do, like exercises and cut down on certain things, and then, yeah. So if there's any question.
So when you talk about carbohydrate, what is the portable carbohydrate one should take?
Our advice on brown rice is good. We can still eat our rice, but not too much. We eat our yam, but not too much. And then I'll be honest with you, we need our carbohydrates. But we are talking about portion control here. And then adding more vegetables and then our salads. But when it comes to listen, I know someone who weighs, all the person eats for breakfast is cornflakes. We know cornflakes is derived from what? Corn. But the person weighs 25 grams of cornflakes. If you ask me to do that, I'll tell you it's too small. But the person is type 1 diabetes. But he eats carbohydrate every day. And he's type 1 diabetes. That is a portion. It's a portion control. And he's not cutting out carbohydrates. He's eating it. So we need it.
Excess amount is what the problem will be.
Yes, excess amount is the problem. So we need it. We have to eat it, but the portion control.
And then we eat it. Some people will not eat it with the salad. So I think that's the problem. Because if you eat a portion of salad, a portion of the rice, I think it will help the carbohydrate to be able to control. So the sugar will not be that much. But when you eating like the whole plate of rice and maybe just about pieces of veg on it, I think that's when it becomes difficult.
Okay. Yeah. So if there is no more question, I'll give you some of the problems we get from that. So for instance, if you don't treat, if you don't know, because if you don't check and you don't find out you have these problems, these are, if you leave it for a long term, these are some of the problems that you are going to get. Like in women, you are going to get like something like ovarian syndrome, polycystic ovarian syndrome. We all know when some of the women get periods and stuff, and if they can scrape it, but the period becomes so painful that it happens at the front and the back that it's unbearable. It's unbearable. And then these are some of the things that the person should be on insulin. The doctors will advise on that. That is not what I am here to do. But the problems that you'll be facing and the long term if you don't treat it. That is what some of the problems you get. Because if you don't treat it, and it affects about 5 to 10% in women. Because it's been left for too long. The person didn't know she had it. She had diabetes. She overlooked all the symptoms. So that's what the person had. Yeah. And then there's something also called thyroid. Thyroid. If you don't look for all these, you get all these problems and people suffer. And these joint pains, muscular pains that we get, like carpal tunnel and frozen shoulders, you get all these muscles pains, and people would think is we term them sickless. And because the person will be having all pains all over, and all people will be thinking, oh, the person is got sickle cell anemic and all those things. Sometimes it's not like that. You have to go and test, and you'll be put into a category. Not everything is termed a sickler. If you leave the symptoms for too long, you might get limited joint mobility. Even this finger here will be like this. You can't even bend it like mine, like that. And it's called limited joint mobility. That is what we call it. It's because you left the symptom for too long and you never knew you had it. It will be a time, all these fingers will be like that, and there will be no movement. They will be stiff. So these are some of the problems you'll be facing in the near future. If a child has it and then they don't notice it, because all children also get it, not just adults. So we have to be monitoring our children as well. And then there's something else called shoulder, frozen shoulder. That one too. Sometimes when you are there, check, do yourself the tests. All these sometimes, and then all these things can be done by yourself. If they are so stiff and painful, you have to go and check. These are some of the things we have to be looking out for. If it's far gone, the doctors will know what to do for you. And sometimes too, it can affect our heart rate. And there's a test called ECG. These are all linked to diabetes, but we don't know. Diabetes can cause all these problems for us. So these things are to be taken very serious. Diabetes is linked to so many problems, low frequency, and then cardiac arrests and everything are all linked to diabetes. If you don't check your symptoms, if you don't take them serious, this can cause all cardiac arrests and everything. So there are things that can be taken into consideration. And it all goes and links back to lifestyle, healthy eating, reducing our oil, and eating the good oils so that we get the LDLs and then cut out the bad cholesterols and everything. Yeah. So it all links to the same thing. Diabetes is very broad. It's very broad. It links to so many things. But it all comes to one thing: lifestyle. How you lead your lifestyle. I'm not going to tell someone not to do this. It's up to you.
What's that one up here?
Where is Papi Kolo? He's the one.
I've seen him. He said good evening. Yeah.
Good evening, Papi. Papi Kolo is the one who can tell you what. This one. All these ones, you see? Not too much of it. It's up to you how much you drink, the intake. This time, I drink more of this. There's no label on it, so I'm not doing any advert for anyone. I drink more of that instead of the one that will make me doze off. So it's up to you to drink more water.
That one is good.
Yeah, this one is good. This one is good.
Says, I think the one that Papi Kolo talks about, he said that one is good.
Okay. So it's best you live a healthy life.
Somebody may not know what you are talking about that Papi Kolo say is good. And since we are educating, I think you should be bold enough to at least bring it out and say excess of that is awesome.
Cut down on your alcohol.
Yeah.
I didn't mention any specific one, but cut down on your alcohol and drink more water. And then this same diabetes, psychiatric drugs also, some of them, these symptoms may also lead to arthritis, asthma, lupus, and most of them anti-rejection medicine used to stop the body from rejecting a transplant organ. So all these are listed to let you know that this same diabetes does so many harm. On the operating table, if you don't know you have it, and they are putting a transplant organ in you, and you don't know you have it.
Before they will do that level, they will check everything about you.
Yes, but people may not know. That is why they always tell you, they caution you to always be on alert. Check it. You have to check. They always advise before it gets at the advanced stage. Yeah. So I think that's it. The complications. I'll talk about the complications now if there is no question.
Okay.
Okay, complications of diabetes. It causes high blood pressure. And then we know we have the high blood pressure. The highest one is dangerous. And then if you have the low one, that one is also dangerous because you can collapse at any time. But with the diabetes one, the high one, if it goes from what I read was 140/90, it's not good. If you are diabetic, and 140/90 is not good. And then high cholesterol, it's also linked to high cholesterol. So you have to check what type of food you'll be eating. Cut out fatty foods, eat more leafy foods. And then we were talking about starchy foods like carbohydrates. Eat it, but in moderation, not too much of it. And then exercise more to burn out the fats and the carbs out of it. As we said, even if it's not running, just walk or jog. 15 minutes a day is fine. And then it's also linked to heart diseases. These are the complications. That is pre-diabetes. That is linked to pre-diabetes. And then stroke. Stroke is another factor linked to diabetes. We have kidney diseases linked to diabetes. So if I tell you diabetes is very broad, it's huge. And then nerve damage. Nerve damage is also another factor. And then fatty liver disease. Fatty liver disease is also there. And then eye damage, including loss of vision. It can make you go blind. So, and then if you don't take amputation. I think this amputation, I think most of you have heard about that.
That one is common.
Yeah, that one is common. So these are some of the things that complicates our lives or individuals' lives when they don't check about their symptoms or they don't know and it gets advanced. That is why they advise people to go and check for symptoms of diabetes.
I think the same way we have cars and go for MOT, that's the same way we also have to do MOT on our body.
Mm-hmm.
It's really important that you check things about yourself.
Mm-hmm.
You don't have to wait till it happens. If you are there, don't wait till you have headache before you call your doctor. You can just go and tell your doctor you want a thorough checkup, and they will do it. They will do everything. If you tell them, maybe I'm not sure, I want you to check my cholesterol level, I want you to check my what do you call it, sugar level, whatever you want them to do, they will do it for you. They will not say because you are not sick. No, no, no. They will do it. But for us to have the time to do that, but we have the time to do the MOT. So the same way we have to do MOT for our body. Why do they do the MOT? Because maybe a year, the car, there may be a problem you don't even know. So that's the same way there will be a problem in our body that we don't even know. So the MOT will then bring it out. It's the same way when you go to the GP and tell them, they will do a thorough check on you. So wherever there is a problem, it will come out and they will have a discussion with you. So let's really think about our body. Don't just rely on when your MOT is going to expire, your mind is there, you know the date. The same way, let us do take care of ourselves.
Okay. And yeah, and then when you don't do it, and then if you don't exercise as well, it's like you're not burning any good metabolism in your system. So what happens is you build up fat, and then it means you are enlarging your waist. You are putting on weight, and then that's when you get high blood pressure, and then low levels of what we call HDL comes in, and then high triglycerides, something. It's this thing. I don't understand their medical terms. I'm not a doctor. And then they have something like high blood sugar levels, and then large waist size, as I've said.
That's the body mass index, the BMI.
Yes, the BMI. So it all comes down to this weight levels. So that one is metabolism. So you have to still exercise. Even if you get your symptoms and then you are told, oh, you've got either the one, but the two, definitely the one you'll be on insulin, medications and stuff. But the two, you can change it through your lifestyle, the way you live your life. You can change it by exercising, eating well, and then doing things the way you are asked to do, advised to do by, as you said, the BMI. I think from 35, you are obese. If you hit the 40s, you are obese. So it's down to you to bring the weight down to the 20s. That is where it's hard. It's hard for everyone, especially when you hit your menopause. But I think, as you said, everyone should go for MOT and then do the checks for ourselves and our children, because it can happen to anyone. Yeah.
So let's take good care of ourselves. I think that's what we want to do. We are educated that will let us really be mindful of things that enters our mouth.
Yeah.
With the mouth, it's ready to take everything, anything you put there, but we have to think and see that what is going into your mouth. Yeah. Adubaniye de ba ekwa wano bisa wo ho. say ko wano no ade na be ye ebi akoto na ntwere mi ke strade bo ho bare wo ba we disade ni na guyem bisa say so ben e na be nya te de ekoye num na wo say ye hwehwe say ehi na ekugu e na ekogu so ben na ye benya. So that's important. Right? If we live our lifestyle anyhow, God can give us long life, but we can cut it off by the way we live our lives. So actually, we should be mindful of things, because if you are suffered and you are wealthy woman or wealthy man, and then sickness strike you, what will you gain? All the wealth, you can't do anything. All the clothes, you don't even feel like doing anything at all. So me nua no mo me nhwe sene a ye didie mu ne ye bibia na ye man yarewa no nke se ye ntimi mpam wo mo kakra yare ne de wo ho, but said ye be ye ho no nso eboa na me etimi kita ye ho yie wunyi a enam ne srade no wunyi a wo se etimi get rid of it eno no emmoa ye emmoa ti. If we are able to cut off certain things, as we said, the carbohydrate we cannot let go. We have to eat it. Brown rice, I know it's difficult to eat it, but even if it's white rice and you have a portion, but the salad should exceed the rice, there's no problem. There's no problem. I know it's not the way we live, but it's difficult. But if you get used to it, it will be easy for you.
Yeah.
So that's the little thing I can add or to all that Akua have said, that let's take care of ourselves. Let's take care of our lifestyle. And that's all we can avoid all this had I know. We don't want had I know. That's why Pasito Radio, we educate for you to know, and then the benefit of it. So it's not only in the church that we preach to save souls. As Akua is doing this and we are talking about this is going to save you as well. So please share the video. Let people get it. Let's know what to do, and let us protect ourselves from all this.
And I think we use tomato stew too much. We can use spinach most of the time. Yeah, sometimes we can. Yeah, spinach is good. Use spinach and then cut some carrots. And do away with the tomato stew most of the time. It's too much.
I
know, but we use kontomire. You kontomire. And you know, yenya kontomire na yamfa spinach kakra. Tomato stew.
Kontomire mba na me no mienu ya waga na kontomire ka say hiafo aduane yo.
But I say no.
We thought that people live eating those ampesie and all those what do you call kontomire or the man so gumu kwa so no. First na yenim the benefit. But now we know that's yeah. So the green, let us try and do it, cut certain things out, and we'll be fine.
Yeah.
Anyway, it's Pasito Radio.
Anyway, say and the mechanic say, yenry say, what 10 minutes walk, crown pa, what enya ufie animu crown pa, or the yero honeye. Na kwa cheki. Kone koshe, kone eko wa wonsa no hwe se ebi wo mu a ebi ni mu a why wa famu die wone wo mba ne nyina enkwara nyina anya ko cheki uni bia wanya wawie
I don't surprise me check one day normal ma will answer just one day it ebe ma time because one day they wait am say no kura no na ne uni di and they wadi kura anya we it's not really a one day thing but unya just said ye person ye can say my doctor ehun
say bibi sa
ehun say bia me dwunso e bia committee awon te no sa na obe check in the monetary dia obe onim ko obe fa so a obe ma days na apart no no mu di ehun say uye say ya na say
I know you're better since that you be travel na ya na say wo baby ato atwene. I know you're better. Yeah.
The night trying to cry the common power that so Gina say a G gone the another say why you're lucky pa na ye picture but only a doff why who and person be who is that. Yes, let's say in I am more day.
Yeah. Yeah, that wants to say
Azitoradio live. I watch you now more than Ghana. www.azitoradio.co.uk. Azitoradio. We keep you alive.
We've kept you alive up to this time, and we thank Akua so much for her time and educating us in this. She's educating us. She said everything connected to it. If you are not sure, just go to your doctor. Just go and see your doctor. If you are seeing any symptoms, we need advice on any tablet for you to take, but go to your doctor and they will help you. You may not know. Just go. Let us do a frequent checkup in the hospital. Until we meet again, we say bye-bye to everyone.